I'm Trisha, and I'm back to discuss some basic knowledge that we want our patients to have regardless of having to make an appointment. There are an impending amount of decay concerns on people's minds. I think when most people come to the dentist, kind of hold your breath until the doctor says no cavities. And I think that most of us understand the basics about them, but I have this just a visual aid to understand that the tooth is alive. It's a living entity, it has nerves, it's connected to the bloodstream, and so when it gets diseased, it needs to be corrected. Unfortunately, most of our decay concerns don't cause us any outward pain until they're more advanced. So dentistry is really tough in the fact that it doesn't hurt until it's generally too late. So we have to tell you sometimes things need to be done, and human nature is out of sight, out of mind. What does bring people in is their sensitive teeth. So as we are seeing people age, we see their tissues are receding, whether it be functional or it be disease related, but we have root exposure. Most people understand aging relating to things wearing down, but what we don't understand is that we see this on our children. Once they've had braces, or if they're brushing incorrectly, or they're not brushing properly enough, the disease can pull those tissues away. So what we are dealing with now is root surface, not enamel. And root surface has no enamel. So for analogy purposes, just think of having a tree living in nature and having had all the bark stripped off from it. It's going to be very susceptible to diseases. The same can happen with the tooth. So people start getting warning signs of cold sensitivity. Sometimes hot, but mostly cold sensitivity. And what we want you to understand is that all of these particular products, like Colgate, Sensodyne, the Pronamels, they actually do mean something. So what I want to, it's a big subject, and I want to touch on it again in the next couple of weeks, going into certain entities, but I want you to know that sensitive toothpastes are for a reason, whether you feel sensitivity or not. If you notice you have any root exposure, you're going to want to tend to go to those because they can help lay down and protect those areas, kind of put the bark back around the tree. And we'll also be mentioning sealants for those areas that we can try to keep those bacteria out of, which are pits and fissures. So we want to start making you aware of what's common and what isn't something you should live with. So make sure you stay tuned in. We'll be talking about root exposure and decay. Thank you.